So I want to introduce Jandra Mueller, who is our Director of PHRC Encinitas and also a clinical expert in SIBO. She has her master's degree in integrative health and nutrition, and it's a topic she cares passionately about because so many of our patients with pelvic floor disorders also have SIBO. So the first question is, how does the overgrowth occur anyway?
Yeah, that's a good question. Oftentimes, it's triggered by something like a food poisoning incident. Maybe you've traveled abroad, you ate some bad food, or it could just be, from a restaurant or you're grocery shopping. So you have some bad food, you go in and you get, your IBS diagnosis because most people don't really know or recognize SIBO as a diagnosis in and of itself. So that tends to be the triggering factor. Why it persists can be for many reasons like chronic health conditions, stress, low stomach acid, maybe you've had GERD for a number of years, so you have poor digestion and absorption, and so that can make it persist.
Next question is it true that healthier eating can actually exacerbate SIBO?
So that's a very interesting question because traditionally foods that exacerbate SIBO symptoms they're called FODMAPs, and FODMAPs tend to be found in fruit and vegetables, garlic, onions. And so if you get your IBS diagnosis and you're, trying to eat healthier, you may actually be consuming a lot of these foods where traditionally maybe more processed foods or fattier foods, they don't actually feed the bacteria. And so you may feel worse the healthier that you're eating. So that's a really good key or cue to talk to your doctor about and just say, these foods really exacerbate my symptoms, which I'm not quite understanding.
The next question is, what are the different types of SIBO and can they all be diagnosed with the same test?
There's 3 types of SIBO. 2 of them can be diagnosed with the breath test, but with methane dominant SIBO, which is one type, this is the type that tends to be associated more with constipation. Whereas hydrogen gas is really the classic SIBO, and that's more associated with diarrhea, along with the other symptoms. Both of those can actually be tested with the breath test. Methane, there was recent updates by Dr. Pimentel, who is sort of the SIBO expert over at Cedars. He now found that methane producers are actually not bacteria, so they've changed the language around SIBO, and they've updated the methane predominant type, to what's called IMO, or intestinal methanogen overgrowth, whereas SIBO is still classically the hydrogen, or another type called hydrogen sulfide. So hydrogen sulfide, there is no way to test this type of SIBO, but there are markers that this may be what's going on the breath test.
So what is the success rate with antibiotics versus the herbal protocols?
So in the research, we've seen that herbal therapies compared to conventional therapies like antibiotics actually have a pretty similar success rate, which are both moderate. And that's where we start to talk about finding, or not just treating SIBO, because SIBO in and of itself is a diagnosis, but actually working with somebody to find the root cause, because you may be dealing with recurrent SIBO if you don't actually address why it's there. So it's a symptom of something underlying, but it's also a disease process in and of itself. If you've tried conventional therapies like antibiotics, many of them were then, if they still had a positive test after, they would actually switch them into herbals, and that seemed to be more successful than just one of them alone.
Next question is, there's often nutrient deficiencies associated with SIBO. Can you talk a little bit about that?
Yeah, this is a very important part of SIBO as well. When we talk about addressing the root cause or the underlying condition, one of those things is low stomach acid. And that can, cause SIBO because stomach acid should be there to kill off the bacteria that we consume that are normal in our food, or the things that we put in our mouth from our environment. So if we don't have enough acid, we actually kind of translocate that bacteria from the food into our small intestine, and that's a great environment for it to grow. But with low stomach acid, that's really important for breaking down proteins. In our stomach, we break down proteins, we activate B12. B12 is such an important nutrient for our energy levels, for our iron. So you may have fatigue, you may have, bruises because you're iron deficient because you need B12. You need B12 to make iron, and both of those things can be affected by the thing that's causing your SIBO. In addition, you may also notice that you have some symptoms of fat-soluble vitamins. So those are your vitamins A, D, E, and K. Because the digestive system is under so much stress, you may actually not be producing enough digestive enzymes, enough bile to really absorb your nutrients. And so these are some of the common ones you may see if you have SIBO.
It's interesting. Can we switch gears for a minute? So before SIBO was a diagnosis, everyone thought they had stomach ulcers. Can you speak to what those actually are and if it's related to SIBO or not?
Yeah. So stomach ulcers can be diagnosed by an endoscopy, and that is actually very important. If you suspect you have a stomach ulcer, when you start to think about treatment will be very different if you have the symptoms of stomach ulcer without an ulcer versus if you actually have a true ulcer. If you have a true ulcer, you cannot do a lot of the treatments to produce have good stomach production because you will actually harm yourself. However, if you have symptoms of a stomach ulcer or heartburn, indigestion, GERD, and you go to your doctor, you're probably going to be given what are called PPIs or antacids to kind of block that. But the issue is it's not too much acid, it's actually acid in the wrong place, and oftentimes it's too low of stomach acid. We need, people that are malnourished, people that have chronic illnesses, are under chronic stress, don't ever sit down to actually eat. Those are all indications that there could be some issues going on with the stomach in and of itself. So, it is important before starting some of these therapies that you do have a workup from your doctor to rule out any sort of ulcer going on, because when you start to get into the treatment of SIBO and looking at the root causes, you want to be careful that you're not doing harm.
Next question. Are prebiotics, probiotics, or foods containing such helpful?
That is a tricky one. So the answer in general is yes, but once the SIBO is addressed. Prebiotics and probiotics, most people don't know the difference. So prebiotics are things like the foods that we eat that are maybe fermented or fiber. That's food for the bacteria that's in our gut. So probiotics one would take which is actually bacteria. We take probiotics to help flourish our gut, and we take prebiotics, or we eat foods that are prebiotics to feed that bacteria. So if you think of overgrowth of bacteria, like in SIBO, is not necessarily pathogenic or bad bacteria, it's just too much of it. So if we're taking prebiotics, or if we're eating foods that are prebiotics, like fiber and fermented foods, we're actually feeding the bacteria that's overgrowing. If we take more probiotics, we're also, introducing more bacteria into the gut without addressing the overgrowth first.
So we made it through a lot of the questions. Thank you for answering. And we know this is tough for people to do and to deal with. So can we provide some words of encouragement as we wrap up the segment?
Yes. I mean, the questions were so great, and so many of you have the same questions. And I think they're great to keep asking, and they're great to keep pursuing to your current providers or alternative providers that you're seeing. And I just want to note that SIBO can be very difficult to treat, especially if you're just treating SIBO and you're not really looking at the bigger picture. It's pretty rare that you can get a diagnosis of SIBO and you do one round of antibiotics and then it's gone. Recurrence is high, and I think the issue with that is that it is a frustrating disease. But yes, I would say that feeling hopeless or feeling like you've done everything, you probably have not done everything. And I think little do you know, there's so many ways to treat this, and there's probably so many risk factors that you may have that have never been addressed. I would encourage you to keep working with your provider and keep asking these questions and doing your research and finding somebody that can actually help identify these and help you treat them.
Because it can end.
It can end. If you have any more questions on SIBO, you can check out our resources below, read my recent post on SIBO. You can also leave your questions in the comments below. If you're interested in scheduling a virtual visit with me, you can also find the link below to do that.